Yes, yes, yes. Welcome to another episode of Hip Hope Hooray, Men Talking Health. I am your MC for this evening. I am Oya Gilbert, and I have a really boss program for you today. Right now, I am on location in Jersey at the Healthevoices Conference, and so excited because I have two of my constituents in the building. I have Mark Harris and Robert Ginyard, and I'm so excited because we're going to discuss today about prostate cancer and the things that go along with that, the struggles, how they got diagnosed. And so I'm going to turn it over and let them introduce themselves. So Mark, please introduce yourself to my squad.
All right, Mark Harris, and I was diagnosed with prostate cancer October 3rd. And 6 days later, my son was diagnosed with a different cancer, and he died 4 months later. So I became a caregiver and a patient at the same time. Yeah.
And how old are you, Mark?
I'm 69. 69.
Was that okay? Because you look like, don't let me ask my age.
No, 69. And I was diagnosed at 58. That's a good question.
Yes.
Diagnosed at 58. So, yeah. It was kind of surprising, but
okay, we're gonna get deep into that as we progress. So, Robert, please tell my squad who you are.
Sure, Robert Ginyard. I'm a prostate cancer advocate now, occupying that space. I was diagnosed at 48. I'm 63 now, but diagnosed at 48, and it was the result of a regular annual checkup. Mm-hmm. And part of what I do now is I really stress to men the importance of early detection, making sure that you get your checkups, because had I not gotten that checkup, my cancer could have been a lot later in terms of staging.
Right, and
so that's my mission today, is really talking to men about wellness, but also addressing multiple phases of wellness, in terms of mind, body, and spirit, and how they all work together.
Man, Robert, I'm with you there, especially on the spiritual thing, because a lot of times people exclude that, and no disrespect to any faith, but I think it's an important element to treatment. So what I want to ask you is, what did you know or didn't know about prostate cancer before you got diagnosed? I'll start with you, Mark.
I knew very little. I'd heard about it. Mm-hmm. But I knew very little. So one of the things is when I hung up the phone, your diagnosis, that it was just, I felt alone because I didn't know anybody. And intellectually I knew men had it, but no one had talked about it. And I think that's one of the challenges that we have in our community. We just don't talk about it.
Yeah, especially us as men. We historically, and black men, we historically are horrible when it comes to taking care of health, and which is why we created this platform to try to make sure that we explain to men that it's okay. It's okay to go to the doctors.
Yes.
And, we definitely have to stop using the ER as our primary care physician.
That's so glad you brought that up.
But same question to you, Rob. What did you not know or did know about prostate cancer?
Well, to be honest with you, and this kind of goes back to grade school, junior high school. When we were in school, you see the charts of the human anatomy, mm-hmm. and hey, the boys being boys, they always see the women's breast.
Right.
But in terms of the male reproductive organs and things, we really didn't pay attention to anything below the waistline. So when you talked about prostate cancer, it's like this new language now. We didn't know what was down there. Mm. And so I think that's a lesson for a lot of men, is because, the prostate, okay, where is that? What does it do? And so it was almost kind of getting reconnected with that part of the body. Now, the good thing about it, Oya, and you mentioned this in terms of using the ER as your primary care place,
Yeah.
And so one of the things that I was blessed, because I've been working with a primary care physician for many years, over 20-something years.
Right.
And so I always had my annual checkups. But what I try to instill in men, and particularly in poor and underserved communities, they use the ER as that place where they get their checkups.
Right.
And so, and unless you're sick or something's bleeding or falling off, you don't go. But a lot of times when you do go, it's the emergency room. And so what I try to do is get men to get started in the medical system, whether it's going to the dentist, to get you in that routine of going to see a doctor.
Right.
Then maybe you move on to your primary care physician. And throughout that, you start to learn the language of medicine so that when you do get a diagnosis or something's going on awry in your body, a lot of that terminology isn't foreign to you because
Correct.
in most cases, when men get diagnosed with prostate cancer and have no relationship with their primary care physician, you start hearing terms of radiation and hormone treatment and all of these foreign terms that you skipped primary care language. Now you are on to the oncology language.
Right.
And that's a lot more frightening language
Than your normal everyday checkup.
Exactly.
And to your point, which is excellent, is that it's muscle memory.
Yes.
And if we don't practice these things and don't do them on a regular, then they become, as you stated, foreign when we get in those situations. But if we practice them, then they won't be so scary.
Yes.
It'll become routinish. And I want y'all to walk us through leading up to your diagnosis. Mm-hmm. And certainly I'll get your take on both of it. Like first, like explaining to the people, what is prostate cancer?
Yes.
But I'm going to start with you. What led up to your diagnosis? And you can elaborate on what prostate cancer is just for educational purposes.
Yeah, so actually my journey started in 2011. My PSA was 5.5. And the doctor said, "Oh, that's high," because back then they wanted between zero.
And for my folks, break down PSA.
My bad.
Let's go. Take your time.
Right, PSA, prostate specific antigen.
Mm-hmm.
So it's part of a blood draw. So they'll look in there, check your blood, and usually you want to get this. African Americans should get it, maybe even as early as 40, because and then if you have it in your family,
Mm-hmm.
yeah, definitely around 40. But 45 is so you want to get that PSA, prostate specific antigen. It's only your prostate produces this, and so if it's in your blood, and then they measure where it is.
Gotcha.
And back in 2011, they wanted between 0 and 4. Now they want it between 0 and 2. But so mine was 5.5, and the doctor said, "Well," he asked me a question: "Have you either had sex or have you ridden your bike? Because both of those could drive your numbers up."
Okay.
So and I couldn't remember, so he said, "Well, come back in a week." Yeah.
You didn't remember if you had sex or the bike? I mean,
no, I'm just saying which one I couldn't remember.
Yeah.
All right, but he said, "Come back in a week." Well, I forgot. And so my checkup was had another checkup 2013. Now it's 13.3.
Mm-hmm.
So
it's elevating.
Yeah, it has elevated. And one thing about in prostate cancer, they call it the doubling rate. So if you have 2 and it goes to 4, then that's a problem.
Mm-hmm.
And especially if it goes to 4 in a certain small amount of time.
Mm-hmm.
Right. Yeah. So so now it's 13.3, and now it's really got I'm much more aware of it. And so I had a biopsy, and then the biopsy, and that's when we found out that I had prostate cancer.
Wow.
Yeah.
So Rob, yours is a tad bit different because I tried to do a little homework. I hope I'm accurate. You began screening at 40. Am I correct? Because of due to your family history.
Right.
You see what I'm saying?
Yeah,
I did my homework.
Oh yeah, you did your homework.
But please tell us your journey. I don't want to ruin it for
Sure.
you. Share your story.
Well, it's a little complicated in the sense that while I have a family history of prostate cancer, my dad had prostate cancer, and this goes on a lot of times in our community. My dad didn't want my mom to tell the boys in the family he had prostate cancer.
Speak
because
on it, brother.
He didn't want us worrying. Mm-hmm. And my mom, trying to be the good wife, she tried to, honor her promise to him.
Yeah, right.
And so as we got older, she told us. But when he was going through it, we didn't know. So fast forward a few years later, now knowing that was in the family, that's when I started to get tested. And I got to tell you, my wife was really adamant about me getting tested.
Yes.
And all shout out to my wife Karen, who is the ultimate helpmeet, who made sure that, hey, did you get your test? Did you do such and such? And so that's how mine was detected. But the other thing about that is because I had a relationship with my doctor, he had been monitoring this over the course of years. And so there was a little spike here, a little spike there, a little spike there. And so then it got to a point where he said, I don't like what I see.
Okay.
I want you to see a urologist now. So, we did the watchful waiting, if you will. This is rising, but let's keep an eye on it. And so when it was rising, he said, we need to go see an oncologist and just get a biopsy and see where this is going. And what's interesting, Mark brought it up when you talked about rising PSA levels,
yes.
Riding the bike and having sex. A lot of time it's taboo to talk in certain communities, but I tell brothers when they're going out to get their test, it's like, look, make sure there's no sex the night before. If I'm being quite frankly, if it's any masturbation or anything like that, just be mindful that stuff affects your PSA.
That's huge.
And what I found is having those honest conversations about sex. Or did you masturbate? Stuff is real.
Man,
and the more
we're
real
not 12.
The more real I can be with you, it resonates because it's like, oh, this brother isn't holding back.
Right.
Then my responsibility is, look, he's depositing into me. Let me do what I need to do. And so that, again, part of what my message is in the community, I can't sugarcoat it. I'm bringing it to you out of love. And if I bring it to you in love, I'm going to have that honest conversation. And so that's what I try to spread out to the community. It's just bringing them the truth. And really that I want you to live long. Our community is being robbed of manhood, fatherhood, because we're not being able to show up. Right. And then, you think about it.
And we're not having honest conversations.
We're not.
On the surface level, we're talking about the game. And at 50, we need to be having some other kind of conversation besides.
Especially.
But that's one of the reasons why I created a discussion called Building Generation Health. You hear all of these conversations about building generation wealth.
Later, but go ahead. Yes.
You hear all these conversations about wealth, but the key to building wealth is being healthy enough to accumulate it. And so building generation health is conversations based on family history, knowing what's in your bloodline. Having honest conversations about, is there cancer? Is there mental health? Are these things that we need to pass on to the next generation honestly and openly, so that if you bring in a child to this world and there's a history of mental illness in the family, that could be a possibility.
Right. Don't ignore.
How do we help that when that issue comes up?
Right.
So that's what I really have so much fun talking about the generational piece, because it hits home for a lot of people.
It definitely hits home in this community, especially in our particular Black and Brown communities, because historically, like you said, when you talked about your father making that wish, and they think that they're doing us a service, by hiding things, but really they're not. Right. And so what happens is, like you said, you have this generational health curse.
That's right.
That keeps traveling along.
Yes.
And I definitely want to make sure we give a shout out to your wife.
Yes, indeed.
Because you made a great point. There's two things. One, a shout out to women holding it down, period.
Yes,
because
indeed.
And pushing and pressing on their men to do something. But shout out to you for being receptive to it. Because there's plenty of women out here that are telling their husbands or their significant other to do X, Y, Z, but they don't listen. And that's crazy work to me.
Yeah, indeed.
Let me ask you, so what was it like? What I want to know is what was like what were some of the major treatment decisions? Because there's different, for example, you have active surveillance versus surgery. Sure. You have radiation hormone therapy. So I'm going to go to you, Mark, and say how your journey went to decide what kind of therapy, what kind of treatment you're going to do.
Yeah. So the first thing is that the word cancer it freaks everybody out, so you have to, so, and I tell my group, you got to separate cancer, the word, from the disease. So what is your Gleason score? Where, so you got to find out a lot of information. So really, where is the cancer now, and how is it affecting you now? And so mine was, what they call encapsulated. So they thought the cancer was inside my prostate.
Right. Mm-hmm.
So they, and because it was encapsulated, my thought process at the time was, we'll cut it out and we'll be free of cancer. That was my thought process. Well, now I realize that now that you have, and I'm very big on this, when people, and even physician researchers, they say, you're cured, cancer-free, remission. I don't like none of those terms because men and women, they stop their screens when they're told they're cancer-free, that you're cured. I don't like any of those words. And I've told physicians, I've told it. So I think, so it's undetectable. So I've been over 10 years undetectable cancer. So, and going back to the decision. So in my mind, if I got it removed, then I'll be cancer-free. So, and that's what I did. That's what I did.
Yeah. Okay. Yeah. And so from a standpoint of like challenges or decision making on side effects, what you have longevity, you got all kinds of quality of life is always a big thing, family. Yeah. How did that play, a factor and weighed in on your decision making?
So the thing, when I finally came to realization that I'm going to have a side effect no matter what I do. So my decision was basically black and white. Do I live or don't I live? That's it. Do I live or die? So I've had men say, I want to have sex or whatever. And I tell men now, you can't have sex when you're dead. So that's
that part.
Yeah. So you can talk about what you want. So it's either black and white. So what gives me the best guarantee, and I'm using guarantee.
Right.
But what gives me a
better outcome?
Yeah. That I'll be here as opposed to not. So in my case, it was, and what I didn't know is that if you have radiation, I found this out later. If you have radiation, if you have another episode of cancer, you cannot have surgery, more than likely. Okay. More than likely. There are some specialists that will.
And did they explain why that is, or?
Yeah, because with radiation, it makes the tissue so brittle that you're not cutting it.
Understood.
Yeah,
okay.
You're not cutting it.
I got you.
But if I have surgery and then I need some more treatment, I can have radiation.
Understood.
So you can go from surgery to radiation. Radiation, more than likely, you can't have
surgery. Go back to surgery. Yeah, gotcha. So it's a process.
Yes.
And that's important.
Yeah.
Huge.
Right. Yeah. And I didn't find that out. So I would have made my decision, definitely what I made, but I didn't find that out. So that's for others.
But it's important to know.
Absolutely.
Because age is a factor on making that type of decision.
Yeah, exactly.
And I'm sure that played a factor, and we'll revisit that in a second. But because I'm sure age is a huge situation. So, Rob, same thing for you. Same question. What was the deciding? What played a factor with the side effects, and how'd you get to that space of your treatment?
Well, once I got over the shock of having cancer, then I call it now the 3 Ds of cancer, and that's diagnosis, data, and decision. I got the diagnosis, what type it was, how severe it was. Then I went to the data. All right, give me some statistics about treatments. How do black men in particular fare in terms of radiation, radical prostatectomy, cyber? I wanted to get all of the background that I could on the various types of treatment. What I was disappointed a little bit about is that there was not a lot of data about how black men fare in terms of these treatments. And that's why
it seems like it's always like this.
But that's why it's important for us to, if you're having the availability to participate in a clinical trial, think of it as paying it forward now. Now there is the stigma, Tuskegee, Henrietta Lacks, so that's there. But I think we're also in a position now where we're really able to monitor who's doing what to our bodies. And we're able to say, hey, what will you do with this information once you get it from me? So there's some checks and balances in place that may be able to replace some of that mindset that we have. One of the things that, I wanted the cancer out of me. So therefore, I said, cut it out. I don't need the prostate anymore. The good thing about it, if we're keeping it real, I am still able to get an erection and to enjoy intimacy with my wife. But I'll share one quick tidbit about the intimacy part. Of course, after my surgery, I had to heal.
Yes.
And as much as I wanted to make love to my wife, I couldn't. you know. And what happened during that time frame though is I learned a different method of intimacy.
Come on, dog. Talk about it. Come on.
Where, man, it was just watching my wife just walk, you know, watching how sexy she was, putting on her earrings or, you know, putting on her shoes. And it's just, I'm like, man, I love that woman. And so I got a chance to make love
Get me emotional over here, homie. I can feel it.
I got a chance to make love to my wife mentally. And I'm like, man, I got some gold here.
Yeah.
And so, you know, holding hands and just snuggling at night. And I'm like, I almost felt bad to a certain degree because I'm like, how long have I been depriving you of these moments?
Of this
level of intimacy?
Yes.
And so, it went to a completely different level in terms of intimacy. And again, it put me in contact with who I am as a man, that while I am able to make love to my wife now, being anything below the waist didn't define me anymore.
Right.
And that's one of the things that I think men still have a problem with is below the waistline.
And I think, and you know, I'm not going to sit here and say I'm overly educated with prostate cancer, but the beauty thing is, like you said, I think a lot of men who just don't know much about it think that, you know, you get your prostate out, you're just done.
Yes,
you
right.
know, but it's not. There's so much, especially with the progression of technology and things that are going on in today's time. First of all, thanks for being so transparent about that. But this is what we do on this show. We keep it super real about things that, you know, the uncomfortable conversations.
Yes, right.
Because that is real life. You know, when it's this 12 o'clock or midnight or 1 o'clock in the morning, you know, and you with your woman, these are the types of things that go on that people don't discuss. So I appreciate you, you know, doing that. I want to get come more on the path. So you've been diagnosed, you've had treatment. Now you stepped into this space of advocating. You know what I mean? And so I'll start with you, Mark, and then I'll go with you, Robert. What got you to that point? You know, we're here at Healthy Voices. You know, Johnson & Johnson has put on this great event, and you're here. This is your first time. What got you into advocating, and what drives you on that?
So so what got me actually started when I went to bed, when I got diagnosed, after I got the call, you have cancer. When I went to bed that night, my human side said, you're going to die. But then my spiritual side said, well, how do we use this to help others? Because God has always given me things to help others. And that's what it started. That's what it started right there.
That's a great place to start.
Absolutely, yeah. So in the morning, I remember waking up, it was a Friday morning, and I was thinking, man, usually people don't tell people that they have cancer and stuff. I said, who are you going to tell? And then I literally laughed at myself and said, who are you kidding? You going to tell everybody. And that day I went to my class and I told them, you know, I have about being diagnosed with prostate cancer. I said, you know, get your PSA check. Get your PSA check. And that was the beginning. And so, of course, I, you know, met you down in
Miami.
Miami. And so it's been great. And the thing is, in fact, on your podcast, you asked me, what about my mental? But I think the fact that, again, that morning I said, I'm going to help others. Little did I know, 6 days later, I'm going to help my son. But the fact that when you take the focus, this is what happened to me, I'll just say what happened to me. Because I took the focus off of me and I'm trying to help others, then there's purpose. There's purpose.
Yes.
So you're not into your, at least I wasn't into the war, because now I have purpose. I'm sharing my story to help others.
Understood.
Yeah.
Right.
Same as Mark. Divinely, I was ordered to share my story. Initially, I wanted to kind of just fade into the background and keep it to myself. But when we go through traumatic things like this, I think that's part of our life's purpose, again, is being able to share our message. And it's been a blessing. And we all have evolutions to our advocacy as well. While I initially started out talking about prostate cancer, and I still do a lot of that, my evolution has also moved into, again, the mental space.
Generational.
Because a lot of times, sometimes our illnesses are born from what we're thinking up here. Ooh. So there's certain stressors in our body, or whatever we have a predisposition to, you know, depending on what level of stress we're undergoing, it may throw off that predisposition to drinking and alcoholism. So we really got to be careful of what we have up here, because we all have something. Mentally, depending on what that trigger is, it could activate whatever we have in our body. And so my advocacy has evolved to not only prostate cancer, but also including the mental health aspect as well.
Man, thank you both for that. And thanks, Rob. I definitely agree. The mental health is so overlooked, especially with men. We've been carrying stuff for since centuries and don't talk. And once again, I told you about that surface talk. We got to really start keeping it real with each other. I got two more things, and then, we're going to jump out the building. This question I have is more of sort of like, what are the myths and misconceptions about prostate cancer screenings, risks, things like that? Just real quick, two from you on some of the myths or misconceptions, like the one we're talking about, like you're just done. You're never going to have sex again or never get an erection again. Right. So you start with you, Mark. What is one of the or two misconceptions?
Well, essentially, because for me, the sexual did not really happen.
Right.
So we got to find out the thing. But that, one thing is that's moving on is that, you don't have to have DRE anymore. They've kind of moved away from that. So I think that stopped a lot of men from not getting checked, so you just get a blood draw. Mm-hmm. That's the main thing I can think of.
Okay, that's cool.
And I would say, the more and more that I'm talking to men around the country is, if I can help them identify their why, and a lot of them have self-identified, once you find that why, you have a reason to be healthy, you get it done. And so I'm starting to see men really start to take life more seriously and say, look, I'm shortchanging my wife or my family by not taking care of me. And so that's been so rewarding to me, is to see men saying, I found my why and now I got a reason to be here.
Right. I really appreciate you saying that, because in a previous episode, I stated that I think that us hiding our health condition as men is one of the most selfish things we can do in this world, especially to our family and loved ones. So go ahead, Rob. Go ahead, Mark.
So in fact, so I'll tell men it's not about you, because I think they make their decision based on them, but it's not about you. There was a time my mother lived 3 houses from the corner. So in the first 7 houses, this is probably 1995, 6 or 7, somewhere. So there's 3 houses. For the 7 houses on this side of the street, 6 houses on this side of the street, 13 of those houses, there was only one man in there. All the other men, all the other women were with
wow, that's correct. That's deep.
That's
super deep.
And the thing about it is, and we hear about men dying. In fact, you look at the top eight causes of death, basically. I think 7 out of 8 black men are leading cardiovascular disease, cancer. Whatever. They're the leaders. But that visual really brings it home. There were 13.
There's so many widows.
Right.
I feel you.
And so we have to work on that.
We definitely got to do that. And I appreciate both of you coming on this show with me. I know you got tons of things or places you could be, but I appreciate you. The amount of advocating that you guys do is tremendous. I really respect you guys, and I love the faith-based thing, because we follow of Jesus, and so I'm really excited about that. So I got one last question that I do before I close out my show. I just want to make sure we know. Please go get your screenings. If you have history of prostate cancer in your family, you need to get it sooner than later. But please start doing something. Just don't sit around. If something's hurting on you, and it's not just about prostate cancer, but if something's hurting, and it's been hurting for the last 2 years, there's probably something wrong. Don't keep ignoring it. But as I close out my show, I ask everyone, when you want to get hyped up, psyched up, geeked up, I need one hip hop song that you would listen to when you want to get pumped up. And I'm going to start with rock.
Sky is the limit.
Woo! Sky is the limit. Okay. I know Mark, he said hip hop. I said, I got another one. Any kind of hip hop that you. What's a hip hop song you like?
Yeah. Well, it's not hip hop. I go to work, but
that's it. That's good. Which go to work you talking about? You talking about the Kumo D joint?
Yeah, the Kumo.
Okay, that's hip hop. Kumo D is. You can't get any more hip hop than Kumo D. Okay, he's a pioneer from the beginning.
That's right. He's a pioneer. Yeah. It wasn't hip hop when I was.
It's definitely hip hop. Kumo D is hip hop.
Absolutely.
So, gentlemen, Rob, Mark, I really appreciate you being here on the show. Mark, and Rob. And I'd like to shout out to our sponsors, which is Johnson & Johnson and of course Pfizer. And as I always like to say, peace out and keep 50 guessing.